Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and today I am with April Walker. She is a nurse practitioner for West Tennessee Medical Group Primary Care in Caruthersville. Welcome, April. How are you today?
Hi, I'm good, thanks.
Good. Thanks for coming in today. So we're going to be talking a little bit about telehealth. Now, we've done a podcast before, but for the people who may have not heard that one, can you kind of give me like a definition of what telehealth is?
Okay, telehealth is any kind of like telemedicine or like video medicine and messaging communication via between a patient and their provider when they're not in the same area.
Okay.
And you can do messaging, it can be via telephone, or it can be via a video app with any kind of device that can access the internet.
Okay. So in Caruthersville, I'm from Dyersburg. I live in Jackson now. I'm from Dyersburg, and Caruthersville is just hop, skip, and a jump away from here. It's not the biggest of towns by any means.
No.
So have you guys had a lot of success with telehealth?
Actually, yes. And I'm from Dyersburg myself also. But I only stay 15 minutes from Caruthersville. And so I see patients from Tennessee and Caruthersville.
Oh, I see.
Because I'm licensed in both. And so my telehealth range expands widely from anywhere from even Jackson. I have patients in Jackson also.
Oh, that's great. So I meant to ask you this a minute ago, but you said you're licensed in both. So I meant to ask you, what's your background? Like, where are you from? How long have you been with West Tennessee Medical Group?
Well, I'm from a little town called Tigrit, which
I know where that is.
Right outside of Dyersburg. And I attended UT Martin for my
Go
nursing.
Skyhawks, same, amazing.
And Austin P for my master's in nursing. And I also have another bachelor's in psych from UT Knoxville.
Oh, great.
And
That's
so
awesome.
Kind of a little bit around it.
Yeah, that's great. So when did you join West Tennessee Medical Group?
I joined West Tennessee Medical Group in actually 2015 initially.
Gotcha.
And I joined as a RN in the emergency department. And I was attending school at the same time I was working in the emergency department. Actually, I worked for West Tennessee Healthcare before that.
Gotcha.
I worked as an RN in Jackson on the cardiac or dealing with heart caths.
Yeah, so you've basically dabbled in a lot of different areas. That's
and
amazing.
Then once I graduated, I just merged into nurse practitioning in the ER. And then from there, I went to the clinic in 2018, and I've been there ever since.
Cool. So going back to telehealth, personally, when I don't feel great, the last thing that I want to do is to leave my couch or leave my bed. So when I learned that telehealth was a thing that was available in West Tennessee for West Tennessee healthcare, thankfully I'm not like a sickly individual. I don't really stay sick, but I learned, I was like, oh, yes, this is fantastic. So I imagine I'm not the only one who feels that way. Do you have similar reactions from patients that are feeling the same way?
Oh, yes. They love the telehealth option. And it's like, if they come in and then they find out about the telehealth option, they're like, oh.
I could have stayed at home.
I could have stayed at home and did this.
Right.
And so they're like, oh, I'm definitely doing that next time.
Absolutely.
It's great, too, because then it's less exposure for COVID. Because that was the big thing when telehealth really became big.
Yeah, absolutely.
It's because of the COVID exposure. And so it's great for us as the healthcare provider, because less exposure, and for the patient, just because we come in contact with so many patients.
Sure, absolutely.
And the symptoms of COVID are so varied. And then even for me, from a personal aspect, like I have an autoimmune disease. I have lupus, and I take medicine to lower my immune system. So it's even more so great.
Right, yeah, absolutely.
We can do video visits. And in the case of, like, say, COVID symptoms, people were very scared and frightened. And so most people were like, just want to come in no matter what. Well, with the telehealth, they were able to talk to me and tell me their symptoms, and I would tell them if they needed to come in or if they needed to be tested or what they needed to do via that option without them having to get out and spread COVID everywhere.
Yeah, that's great. My initial question is, like, I've fortunately not had to do telehealth much. So anytime I've gone to the doctor, I've physically gone there. But I guess my question is, do people think it is as effective as going to the doctor? Yeah. There's something, I think, to be said for like physical touch when it comes to seeing your healthcare provider or being around friends or family or whatever. So
that's why it's some appointments that you can't do via telehealth. But like the basic ones, like say a sinus infection or like you think you have a urinary tract infection or something like that. Like we can call you in antibiotics over the phone. Like talk to me, you tell me your symptoms. We know these symptoms, and so we can treat you based off them symptoms.
Gotcha.
And then even then, say like the symptoms don't resolve in a day or two, then come on in.
Gotcha.
And then
Okay.
we can do a touch assessment.
Yeah. Okay. Well, that's great.
Well, another great benefit of telehealth that we have right now is in Caruthersville. Like you said, it's a very small town and it's a very rural town.
Right.
And specialists are really far out.
Oh, so
And
that makes sense.
The telehealth has made it more convenient for them to be able to get to specialists, whereas they normally wouldn't be able to go because they're so far out.
Right. Well,
And
that's
so
great.
That's made it a big help too.
Yeah, absolutely. Say there was somebody, like a patient that you just saw at Walmart or something, and you have seen them before, but they were just hesitant about using telehealth. They prefer going in person. I get it for sure, but what would you say to that person who was just a little hesitant, didn't necessarily trust that my information was going to be protected? Because everything telehealth is HIPAA compliant. All the information is not going to be leaked out. There are encryptions set forth to make sure that personal information stays personal between you and your doctor. So I guess my question is, what would you tell that person who is nervous about, for lack of a better term, trusting telehealth?
Well, I know at first we had a telehealth feature that we were using called Hell. We West Tennessee had purchased telehealth feature that they were building especially for telehealth. And so it was like, very, very encrypted because it was just made especially for West Tennessee. But then we noticed that Athena, which is our charting system, has its own telehealth that we can use. It's a little button we can click in there. And so since our charting system, that has to be very secure.
Sure.
Because it contains all our patient information. Everything you tell me, I put in this chart. Like I type it up. All your prescriptions, all your diagnoses are in there. And so that's what our telehealth is through now. It's through our charting system. And so like anything that goes in there is all connected in there together. So it's not like an outside source.
Gotcha. So for those patients, do they have to download a certain app to be able to use that? Or is it like a FaceTime?
They just get sent a link and they click on that link.
Oh, I see. Gotcha. So there's no app you have to download. There's no extra putting things on your phone or anything.
They don't have to register or nothing. They click on the link, and then they put like their name in, and then they'll be ready. And it goes through the same process like how they're coming to the office. The front desk will call them about 15 minutes to 5 minutes before their appointment to get them checked in and make sure nothing's changed. Yeah. And then when it's time for their appointment, the nurse will get on and do their information and go through, everything they do, the intake process like normal. And then she'll let them know that, to hold for when the provider is ready for them.
Gotcha. So obviously COVID has been a terrible thing for the world, for here in West Tennessee and Caruthersville, but I'm a silver linings kind of person. I try to find like the positive in everything, and I really feel like COVID has forced a lot of people to essentially go into the 21st century. So the fact that we have telehealth now that we can use for more than just COVID symptoms, we can use for sinus issues or really insert here, pretty much anything you can really think of. I think it's awesome that we're able to actually utilize that and our patients are able to utilize that. Now in a COVID world, in a safe way, but things kind of calm down, I really do think it's going to be a continual option that we're going to have. Yes, and I think it's great.
So too. And I really like that we can do mental health via telehealth.
That's huge.
Because that's been a big problem. I know in Caruthersville for sure, but even so over here, because in the ER, we used to get so many mental health patients, and it would take, you know, Pathways hours to come, but that's because they were covering all of like West Tennessee.
Sure.
And then the assessment, they would have to send them out to like either like Memphis
Mm-hmm.
or somewhere like that. And so, or even outpatient was still just that far. We didn't have good outpatient.
Mm-hmm.
And so this virtual health, mental health has gave, you know, more people access to their mental health. And I guess they feel like they don't have to get stigmatized from going into mental health buildings. Like they don't want nobody to see them. It's fine. Do a telehealth. Nobody knows.
Yeah, from the comfort of your own home. So that's great. So April, you're currently accepting new patients in Caruthersville. Is that correct?
I am.
Fantastic. So like I said, if you're ever interested, if you need to talk to someone, be it for mental health or you want to do telehealth visits and you live in the Caruthersville or Jackson or Dyersburg area, April's your girl. She can help you out. She's located at West Tennessee Medical Group Primary Care Caruthersville Clinic, and their phone number is 573-333-0033. Well, April, thanks so much for coming in today. This has been a great conversation.
Thank you for having me.
Absolutely, and this has been another episode of Will You Talk Health.